there is a lot that has been said and done before with regards to both the accuracy and the relevance of public messages. Health is not an exception. We have seen fake news before, and I'm sure we'll continue to see fake news as we go forward. But we have used a very simple model that describes the wrong information based on two overlapping concerns or two overlapping issues. The first one is the level of falseness. And then the second one is the intention to harm. And we describe misinformation as information that is false, but some of it is actually kind of not really generated with an intent to harm. And within that, we have all seen things on WhatsApp that make you laugh, jokes, and all of that attributed to someone, but with no really intent to harm. Then you've got malinformation, and this is when there is a deliberate intent to harm, and things are misquoted, things are misjudged. We live in a world where people like to read the headlines, and so headlines are misconstrued, and those people who don't have the time to read the body of the text will come to the wrong assumption or wrong analysis because they've just read the headline. So that's one example of malinformation. Then the extreme end is disinformation, and disinformation is usually very well calculated with a deliberate intent to harm, to undermine, as Dr. Chireka has said, or to discredit efforts that are being put forward. And so quite a lot of that will include things that are actually not true, things that are not plausible, things that you cannot explain biologically as a scientist or public health person, but they are wrapped up in lots of emotional and emotive language. And when it is received by the person, it evokes an emotion, and you end up with people refusing an intervention, in this case a vaccine, for things that they do not understand, but they strongly believe in either the message or the messenger. And there is quite a lot of disinformation going around, where we know some of it has been traced back to people who are generally anti-vaccinations or people who do have a hidden agenda. So that information disorder has got a sliding scale based, ranging from just basic, well, yeah, we'll just make fun of whatever happened yesterday, but we are not intending to harm, to actually very well calculated and deliberate attempts to discredit or to evoke an emotional response so that people don't uptake, in this case, a vaccine that we know is available.
For the widespread of the fake news, as Professor already clearly explained, I'll just add on 4 things that we need to look into. One is that we have got social media, which is easily available. And on social media, we do have the so-called friends, and we trust these people. So what happens is that this media is used such that when something is spread by your friend, you tend to trust it, and then things go viral, even if it is actually a fake. And then also, it also reinforces the preconceived notions or idea that people may have when these things are spread, especially coming from a trusted friend. And another thing is that when this information is being spread, fake news, it comes with results. In terms of research, we may not find good results, but fake news will always come up with results. And another thing, as Prof already said, is that they sensationalize, they exaggerate the language that is used. It makes it juicy. Whereas when you look at it, as Jonathan Swift said, he said falsehood flies and the truth comes limping. The problem when you are coming with the truth is dry, it's not sensationalized, it's not sexy, it does not incite people. But when you come up with fake news to say the DNA will be changed, to say that, oh, you will become a chimpanzee, it evokes emotions in people. And so that's why people become manipulated by that information, because it is taking advantage of people's emotions, and also it is being used and transmitted through our networks, because the people that we are with on social media are the people we trust. So if anything is coming from Prof, I would trust it. If it's coming from Dr. Chigia, I would trust it. But even if it's fake, but just because it's coming from a trusted friend, I would think it's correct. That's why fake news goes viral.